Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts in the Nose series, we're going to be talking about why or when you need osteotomies, which is the fancy word for breaking of the nasal bones. So not all people know that this may or may not happen during your rhinoplasty or nose surgery, but it is a fairly common thing that we will do. It's usually done for one of three reasons. The first reason is something that you just might expect if your nasal bones are crooked. So if your nose is kind of shifting one way or the other, we need to break them to kind of reset and move it to a straighter position. The second reason we'll do it is if your bones are wide. This is also a very common thing for people who want to get their nose a little bit narrower, so we'll break it to physically bring them inward. And then the last reason, which is one that people don't really know, is that when you have a dorsal hump or a bump on the bridge of your nose and we bring it back or take down the hump, sometimes it can create something that we call in surgery land an open roof deformity. So it's kind of like a house with a roof, and then you take off the top of the roof, so now the roof is open. So what we have to do is fracture the bones to close that roof again, so that way you don't have a little obvious ridge from where the hump used to exist. So that's the third reason we'll do osteotomies or breaking of the nasal bones. It's a relatively easy, common thing for us to do. It does usually involve something that looks pretty crazy, namely a hammer that kind of helps do the job. Some people also use ultrasonic cutting devices to help break the bones in a more precise fashion, but that's essentially how we accomplish it. And then usually these bones are on the weaker-ish side enough that we can actually physically manipulate and push the bone the direction that we need it to go, narrow it the way we need it to go. And then of course it gets stabilized with a cast on the outside that you usually wear for about a week or so after surgery. And that is it on breaking the nasal bones, osteotomies in rhinoplasty or nose surgery. Again, this is Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery. We will see you guys next time.